Good morning to you all, and thank you for joining me on such short notice. My name is Shantae Person, and I am the Chief Operating Officer here at ABC Health Hospital. As you know, over the last several months, the healthcare industry has been experiencing challenges never seen before in history due to the COVID-19 pandemic. ABC Health has been put to the test regarding important issues affecting our organization, such as supplies, budget, and personnel. I have invited you all here to explain the plan for changes moving forward and strategies for recovery. This presentation will provide guidance for what is necessary in continuing to provide quality care to our patients while adhering to our mission. Before we begin, I would like to provide you with information about who ABC Health Hospital is and the service to the community. We are a nonprofit critical access hospital located in a rural community with 16 beds certified since 2001. The facility has physicians who are MDs that may be off-site, advanced practice providers who work independently, and there is flexibility with the nursing staff available depending on inpatient stays. The emergency department provides 24-hour emergency services with a doctor, advanced practice provider, or clinically trained staff member always present, and our acute care patients have a limited length of stay at 96 hours or less. We also use swing beds for the skilled nursing facility, acute care. Due to COVID-19, there is temporary emergency coverage without a qualifying hospital stay and a current waiver for the limitation on the number of swing beds and length of stay. In addition to those services, we also offer observation services, respite care, general surgery, and outreach to specialty care. There are only 45 states that have critical access hospitals. This determination was made by the Centers for Medicare and Medicaid Services with an objective to reduce financial vulnerability and improve access to healthcare in our community. We are a part of a medical rural hospital flexibility program, which provides the benefit of cost-based reimbursement for Medicare services, flexible staffing and services, capital improvement costs, included in allowable costs, and flex program resources for education, technical services, and grants. ABC Health always strives to provide the best quality care to our patients with a goal of exceeding in ratings of the Hospital Strength Index that assesses rural hospital performance areas such as market share, quality, outcomes, patient perspective, cost charge, and financial efficiency. From what has been learned and experienced so far during this pandemic is that there are unknown risks and challenges that will continue to be encountered. While the situation is very unpredictable, the importance of collaboration is taken into high regard. Preparation for what could be an unusually high number of patients presenting to our facility has led to the creation of a planning committee designed for meeting the needs of all operations. The committee will include representation from hospital administration, risk management, infection control, occupational health, disaster coordinator, public relations coordinator, medical staff, nursing administration, emergency department, billing, purchasing, and materials management, engineering and maintenance, housekeeping, and security. Our team will also have assistance from representatives of diagnostic imaging, sterile services, pharmacy services, lab services, behavioral health, local community volunteers and representatives, clergy, and the county coroner's office. As events occur, this committee is subject to change and more members could be added based on our needs. Stakeholders involved will be the patients, staff, and leadership, providers, suppliers, payers, pharmacies, the community, and the government. It will allow us to maintain sustainability from a financial and operational standpoint. We want to encourage as much stakeholder engagement as possible to increase efficiency. Collaboration between ABC Health and stakeholders will provide opportunities to share and develop data and solutions. Their roles are paramount in ensuring organizational readiness. Plans are proactively addressed to avoid clinical, financial, and operational crises. The emergency department throughput is followed and staff is being productive. They also want to ensure that efforts are being made to reduce the length of stay. There is a demonstration of good stewardship and productivity in billing, and shared decision-making processes are carried out to reduce risk of malpractice. Stakeholders believe in teamwork and patient satisfaction. COVID-19 has also added more strain to behavioral and mental health among clinicians and stakeholders who want to establish that efforts are made to ease the burdens to avoid burnout. They're also thinking about the importance of reducing admissions and avoidable emergency department visits. This is a value task because there are hospitals that see many patients that are uninsured or on Medicaid. Involving stakeholders in quality initiatives, increasing transparency and public awareness is necessary. The contingency plan for supply chain management at ABC Health follows the guidelines put in place by the CDC. An estimate of required materials, equipment, and personal protective equipment will be assessed. Local and regional planning groups will be notified of the estimate to aid in stockpiling agreements. To handle expected supply shortages, such as PPE, we have collaborated with our normal suppliers and secondary suppliers. For supply communications, there will only be one point of contact when needed to order secondary supplies. Because of emergency use authorizations that have been put in place, it has allowed for supplies that are faulty and ineffective to make their way into facilities. To avoid this, secondary suppliers must go through a vetting process. Build a connection with suppliers in advance and keep an approved vendor list. An automated tracking system will be utilized for use of all medical supplies. Clinical and operational leaders have created a strategy for handling situations in order of priority when there is a critical limit of supplies and medications. To follow all guidelines by the CDC for infection prevention and control, ABC Health will follow the hand hygiene requirements, proper signage, proper PPE availability, and use of IPC precautions, and availability of masks. Trash bins can easily be accessible for staff to dispose of PPE, and hospital-grade disinfectants are mandatory. As a rural healthcare facility, the importance of emergency preparedness drills is imperative. So they are also a part of the contingency plan to test durability and safety of our supplies, both from existing vendors and secondary vendors. The supply coordinator will have permission to make small purchases, which enables a swift response in critical times. ABC Health Hospital has created a team of staff that will work specifically on handling COVID-19 patients. There will be an admission and triage process that will be unique to these patients. There will be designated areas for these patients and protocols to be followed with appropriate signage in place. This team will receive special training to handle various scenarios and isolation practices. Patients must be social distanced, and if not, an option must be that they can wait in their vehicle. Triage will take place over the phone, and assessment to determine critical cases will take place. There is 19% of the U.S. population living in rural communities, and 1% of those hospitals have ICU beds. We do not have ICU beds in our facility, and so transport will be necessary for all critical patients. In the event of a patient needing the transport, there will be advance notice provided to arrange with EMS, infection control, and health department or the health department will be notified as soon as possible of new COVID-19 cases, and there will be tracking on those being admitted and discharged. Aside from the newly created COVID-19 team, there will be retraining of staff who will have changes to their roles to incorporate new protocols such as telehealth services. Practitioners will be redeployed to roles where there is more need, since there will be a decline in the number of elective procedures. Increasing leadership communication through video conferences to discuss time-sensitive information and challenges will be faced daily, and weekly communications with staff to address concerns will take place as well. The throughput process during this time is a priority because the objective is for the patient to spend the least amount of time possible from start to finish of this process. The visitor policy has been modified within the last year, and signs have been posted to notify any visitor with fever or respiratory symptoms not to enter the building but to use the phone triage services. If a patient is suspected to have COVID-19, PPE will be used. If the patient is being treated for symptoms or diagnosed with COVID-19, unfortunately, no visitors will be permitted. Patients will be limited to one guest during the time they will spend in the facility. For all other services, and all visitors are required to wear a mask and follow all COVID-19 precautions while in the facility. This slide shows the current throughput cycle that we are using at ABC Health Hospital. Right now, we have an estimated check-in phone triage time of 10 minutes. The wait times can vary between 12 to 15 minutes, where the patient may be waiting in their car or in the designated waiting area. They may wait in the exam room and have their vitals done about 7 minutes. They will wait for the provider. Usually this time can run between 10 to 15 minutes of waiting for the provider. And once they have the provider come in, the exam will take about 15 minutes. And after that, the patient will be discharged. Capacity management has been a long time concern of the U.S. healthcare industry because it can lead to constraints. ABC Health needs to be prepared for many patients to present at our facilities, and this will include patients who will be positive for COVID-19, among all other patients with injuries and other forms of exposure. We will also factor in all other services like chronic diseases and labor and delivery. This emergency planning task is necessary as a part of the Hospital Preparedness Cooperative Agreement. The waiver for increased beds will be useful for the expected influx of patients. Staff have been briefed on mandatory overtime and modifying schedules that could occur in the event of a capacity surge. Telehealth and standby triage areas will go into action. Agreements have been made with surrounding area hospitals for the care of non-COVID related patients needing treatment, as well as agreements for the care of non-COVID related patients needing treatment and transportation services. Alternative spaces have been determined within the facility where inpatient beds can be placed to treat additional patients. Coordination with local and state planners will aid in the preparation of accommodating additional patients, ensuring there is enough staff, supplies are readily available, and in predetermined alternative care locations. Elective surgeries that are scheduled must be screened and reevaluated to determine if they require cancellation. If home care is an option, the provider can decide to have a patient treated outside of the hospital setting. There will be an increase in call centers and telemed services as well. The ethical issues related to decision making must be kept a high priority. Daily staffing status will be assessed, and legal counsel are involved in the event of a crisis impacting staff. To anticipate staff shortages, we are working in connection with local planners to seek out new employees. For post-mortem care, we have set a rental agreement with the refrigerated truck rental company for storing the deceased patients. We will also continue to work with the county coroner's office and local mortuary for storage arrangements as well. The pandemic has caused a decrease in revenue for all hospitals, but for ABC Health, there is the added strain of being a rural hospital. We were a facility with regularly scheduled elective procedures, which was an abundant contributor to our financial sustainability, and this is now taking a sharp decline. The financial pressures have caused many rural hospitals to close doors, which adds to job loss and unavailable healthcare resources in these areas. Even though federal funding programs have provided temporary aid, it may not be enough. Certain private payers and Medicare have also completed advance payments in an attempt to support rural healthcare facilities. During this time, payers and policymakers should make exceptions regarding payment models and allow an all-payer global budget. This model would have payers and private insurers paying in one fixed amount for care delivery to one population for a particular time frame. Hospitals will be able to know what funds will be expected ahead of time, and the connection between volume and revenue would exist for the time being. An all-payer global budget will help these hospitals with financial recovery and give them added flexibility to handle health-related changes within the community. The direct service costs at ABC Health Hospital come from the emergency department, inpatient services, the laboratory, the radiology department, drugs, and medical supplies, adding up to 80% of the direct costs. The overhead costs, which are categories such as nursing management, medical records, housekeeping, and laundry, are at 20%. Rural hospitals have less administrative costs than large hospitals. Because the services of direct costs make up such a large percentage, ABC Health will continue to struggle to be profitable in payments for these services are inadequate. Metrics of performance is the data that determines the level of quality provided to our patients, our actions, and our abilities. For ABC Health, we have incorporated the Baldrige framework to be prepared for any uncertainty ahead and to be resilient. It is such a useful tool for quality improvement and performance in healthcare. Value-based reimbursements have caused challenges at ABC Health as the struggle to adjust has been difficult due to multiple other challenges such as health disparities, workforce resilience, acceleration of technology, and the expanded focus on additional concerns that have been linked to hospital performance such as community and society. With all the challenges, we must maintain our focus on quality and incorporating a comprehensive systems approach that consists of a method for calculating and showing value is going to be useful in tackling these changes. Please see this boundary framework concept that shows all the characteristics within operations and how they work together. As previously discussed, changes are occurring at a rapid rate in rural healthcare, and not all of them are accepted with a warm welcome. Healthcare workers are more receptive to change when they have the chance to impact the change, when they feel they are ready for it, and they see the value in it and understand how the change will be worthwhile for the patients. strategy must be implemented to function in connection with a change management system. Improvement processes can be enhanced with use of Lean and Six Sigma. Another important step is to hold the gains and recognize that there will be highs and lows in this process. Also, force field analysis can be used for those who support and those who do not support a change. In the case of ABC Health, changes are necessary for the survival of this organization. To advance in the quality improvement process, communication is high on the priority list, along with engagement and stakeholder contributions to quality improvement efforts. Small-scale demonstrations are easier to manage and are a good method for improving new processes and determining influences and consequences while strengthening the favor of the stakeholders. Remind employees that quality improvement is a task that can be repetitive and it is a learning process of trial and error. Constant corrections will be made until the best strategy has been established. In conclusion, ABC Health Hospital is not alone in the implementation of new strategies for continuing to serve the community during COVID-19, as other hospitals are also facing tough times. Our rural location has set us apart, but we continue to move forward to provide the best possible care to our patients. Supply management plays such a critical role in this process, and it will take our entire organization to work together to encourage, implement, and follow through on proper practices to achieve success. I would like to thank the Board of Trustees and the Executive Board for joining me today, and I look forward to collaborating with you on this plan very soon. Thank you very much.